In emergency medicine, there are some drugs that are just absolute game changers. Today, we're going to do a deep dive on one of them, a medication that clinicians rely on to turn the tide in the most critical moments. Let's get into it.
So, what is this wonder drug I'm talking about? I mean, what single thing can pull a patient out of shock, slam the brakes on a massive allergic reaction, and prop up the body during an adrenal crisis?
Well, this is it. Hydrocortisone. Specifically, we're talking about the form you see in emergencies, hydrocortisone sodium succinate. It's a powerhouse corticosteroid, and we're about to unpack exactly what it does and why it's so incredibly important.
So here's the game plan. We'll kick things off with the basics, then get into how it's actually given and the magic of how it works inside the body. After that, we'll look at the big moments when it's used, the risks you gotta watch out for, and what doctors and nurses are looking for. Basically, the whole shebang, from the vial to the vein. Okay, let's dive right in. Section 1, what is hydrocortisone? Let's get to know the basics.
So at its core, hydrocortisone is a short-acting corticosteroid. But here's what makes it kind of special. It has this dual activity. It's got glucocorticoid effects, which are amazing at fighting inflammation, and it also has mineral corticoid effects. Now, what does that mean? It helps your body manage its salt and water balance. And having both of those things in one drug, that's what makes it a hero in situations like shock, where you've got to fight inflammation and keep blood pressure from tanking.
Now, you'll hear it called a few different things. A doctor might yell for Solute Cortef, or you might see a box that says Hydrocort, Hyosone, or Cort Sib. Just remember, it's all the same good stuff inside, hydrocortisone sodium succinate. And here's what it actually looks like, right out of the hospital pharmacy. See? Solute Cortef, Hydrocortif. It usually comes as a sterile powder in a little vial. Before you can inject it, you have to reconstitute it, which is just a fancy way of saying you mix it with a sterile liquid, usually water, to get it ready.
Okay, so we've got it mixed up and ready to go. The next big question is, how do we get it into the patient where it can do its job? Well, you've got two main options. Into the muscle, that's IM, or into the vein, which is IV. And look, in an emergency, every second counts, right? So you're almost always going to go the IV route. Putting it straight into the bloodstream means it gets to work, like, right now. Dosing is super important, and it's different for adults and kids. For an adult in a crisis, the standard play is a 100 milligram IV bolus. A bolus just means a single, quick dose pushed right in. For kids, though, you have to be way more precise. It's all based on their weight, usually somewhere between 2 and 4 milligrams for every kilogram they weigh.
All right, so we know what it is and how to give it, but the really cool part is how it works. What is happening inside the body that's so life-saving? Let's get into the science.
Okay, prepare to have your mind blown a little bit. Hydrocortisone works at the genetic level. This is wild. It doesn't just block one little thing. It goes straight into our cells, hooks up with these special receptors, and that whole package marches right into the cell's command center, the nucleus. Think of it like a Hollywood director storming into the writer's room, grabbing the script, which is our DNA, and rewriting the scenes on the spot. It literally changes the instructions to shut down the body's massive, out-of-control inflammatory freakout.
And what happens when you rewrite that genetic script? You get these incredible, powerful actions. It's a massive anti-inflammatory, it's anti-allergic, it also suppresses the immune system, and this is so important, especially in shock. It helps maintain vascular tone. That's just the normal squeeze of our blood vessels. It keeps them from getting all loose and leaky, which is what causes blood pressure to crash.
So what's the life cycle of this drug in the body? Well, when you give it IV, it starts working fast. It's considered short-acting, which is perfect for getting a crisis under control without lingering too long. Your liver breaks it down, and then your kidneys get rid of it. So a quick arrival, it does its job, and then it makes a clean exit. Okay, we've got the science down. Now let's connect the dots to the real world. When are those critical moments that a doctor reaches for this stuff?
Septic shock is probably the #1 example. This is a terrifying, life-threatening situation where a huge infection makes the whole body just inflamed, and blood pressure plummets. Remember that vascular tone we talked about? That's what's so critical here. Hydrocortisone helps squeeze those blood vessels and stabilize blood pressure when nothing else is working. But it's not just for septic shock. Oh no. It's absolutely essential for an adrenal crisis. It's a key weapon against severe anaphylaxis and really bad asthma attacks. And it can even be used to bring down swelling in the brain. That's called cerebral edema.
Pretty much, if the body is in a state of total inflammatory meltdown or allergic chaos, hydrocortisone is on the front lines.
But listen, any drug this powerful is a double-edged sword. It doesn't come without risks. So let's flip the coin and talk about the potential side effects and dangers.
Yeah, and it's really important to draw a line here between short-term emergency use and long-term therapy. In an ER situation, what we're really watching out for are things like high blood sugar, that's hyperglycemia, spikes in blood pressure, so hypertension, and the body holding on to extra fluid. The really serious long-term stuff like a weakened immune system or brittle bones, osteoporosis, that's usually what you worry about when someone's been on steroids for a long, long time, not from a single emergency dose. You also have to be super careful about what other drugs the patient is on. I mean, these interactions can be serious. For example, if you mix hydrocortisone with NSAIDs like ibuprofen, you crank up the risk of stomach bleeding. Give it with diuretics, and you could cause a dangerous drop in potassium. It can even fight against diabetes medications, making them not work as well. And you definitely don't want to mix it with live vaccine.
So, with all those risks in mind, what do doctors and nurses actually do to keep patients safe when they give this drug?
The number one rule, the absolute key, is watching the patient like a hawk. This is not a give it and walk away kind of medication. The whole clinical team is constantly checking in, assessing how the patient is responding, and looking for any little sign of a problem.
And what are they looking for exactly? Well, they're keeping a super close eye on blood pressure, they're doing frequent blood sugar checks, they're monitoring electrolytes, especially sodium and potassium, and because it can suppress the immune system, they are on high alert for any new sign that an infection might be brewing.
So it all comes down to this, doesn't it? We have this incredibly powerful tool that can literally pull people back from the brink of death, but it also comes with some pretty significant risks. And that leaves us with one of the biggest questions in medicine. How do you balance those incredible life-saving benefits against the very real potential for harm? Especially when you only have minutes to decide. That's a tough calculation that clinicians have to make with every single patient, every single day.